Everybody, happy lunchtime. How are we all doing? Oh, it's lunchtime in the UK, and some of you are watching replay as well. So, whatever time you're watching, I hope you're well. I hope you're having a cracking day. Firstly, just to say thank you very much to Jen, who brought forward her talk on exercise yesterday because I really wasn't well. So thank you very, very much, Jen, for that. I hope you all enjoyed it. If you haven't had a chance to check it out yet, please do. Jen is a menopause specialist and helps women going through that particular stage in life. And she talks through really easy stages in terms of building exercise and things into your routine. Give it 10 Jen. Those of you who work with me will have heard me talk about Jen. Give it 10 Jen before. So yeah, if you haven't had a chance to catch that live, please do so on replay. It's in the group, so you can find it quite easily. So yes, thank you very much for joining me today. Today I'm going to be talking about some of the myths surrounding endometriosis, some of the things we get told when we're diagnosed right the way through our journey, debunking them, so seeing why they're not true, what impact believing them can have, and also where they've come from, so seeing if there is actually any grain of truth in any of them. So I've written down 11 of my favourite myths around endometriosis, but if you have got any questions as I'm going through, or if you can think of another myth you'd like me to debunk or to explain, then please do add it in the chat box. Okay, so let's dive straight in because there are a few of these. So the first myth around endometriosis, just to chat about, is the fact that there's no cure for endometriosis. So this is something that you will hear right from the beginning of your journey. So as soon as we're diagnosed, we get in all the literature, in all the doctors' conversations and everything that we have, it's hit home to us that there is no cure for endometriosis. And this is something I feel really, really passionate about. It's something that I wrote in my blog yesterday. And it's really, hi Jen. Oh, bless you. Yes, I am. I'm feeling a lot better today. I can talk. So that's a bonus. But it's for me anyway. But yeah, thank you very much for stepping in. Yeah, so there's no cure for endo. So yeah, this message is hammered to us when we first get diagnosed that yes, you've got endometriosis, and I'm really sorry, but there's nothing that can be done. Now, I don't understand why this message gets hammered so much to us on our journey, because as far as I'm aware, and I am probably wrong, I'm more than happy to be wrong, but as far as I'm aware, there is no chronic illness that has a definitive cure. There isn't a single illness that somebody can present to you with a pill or with a course of treatment and say this is guaranteed to clear up your whatever it is. Yet I don't know any other condition that people really hang this hat on. There is no cure. Endometriosis, yeah, there is no prescribed cure, there is no recognised cure in Western medicine. However, there are people for whom their endometriosis clears up. There are people for whom they still have endometriosis, but they can live with it and it doesn't impact on their lives. For me, the belief that there is no cure for endometriosis is a limiting belief, and it's setting people up to struggle with their journey towards a cure or their journey towards their cure. Because there's there's a few sayings around this, but there's one saying that whether you believe you can or you believe you can't, you're right. Now, if you believe there's no cure for endometriosis, you are telling yourself that you're never going to be better. So you're forming a belief right from the earliest stages of the illness that you're stuck with this, that it's never going to get better, that this is exactly what you're stuck with for the rest of your life. And I think that's really damaging. We all know there's people who work with me will know that I'm really passionate about the intrinsic link between the body and the mind and the soul, but the body and mind in this case. Your body listens to everything your mind tells it. So we're constantly told things about positive mental attitude, about reframing damaging beliefs. And I think this is just a damaging belief. Our bodies respond to what we're telling it. So if we tell our bodies that we are in pain, over time we will start to feel pain. Now that's a real generalization. But if we start to, and it's the panic response as well. So if we tell our bodies there's something wrong, if we tell our bodies that we're panicked, then the bodies respond in that way. Our minds cannot tell the difference between a perception and a reality. So if you're constantly telling your body, yes, I've got endometriosis, no, there is no cure, your body responds to that. At a very, very basic level, your body is responding to you saying, you're stuck like this, you're stuck with this. So whilst it's not a myth, whilst it's kind of true, there is no recognised single cure for endometriosis. Rather than telling yourself that, rather than listening to the doctors that make you believe that, reframe that thought and say, actually, people do recover from endometriosis. There are people in various groups, in various circles that you will come across whose endometriosis is no longer an issue. Focus on them. Rather than focusing on the belief that there is no cure, focus on the positives. Focus on the fact that actually you might be able to cure this, and you might be able to at least minimize the symptoms to enjoy your life again. I was going to give an example. One of my clients, I'm actually working with her at the minute. She's actually got cancer. She isn't an endometriosis client of mine. She's got cancer. She was given a terminal diagnosis. She was given 3 weeks to live 6 weeks ago. And I'm actually using the endometriosis protocol with her. And we've done 6 weeks, sorry. And she's getting stronger every day. Her stats are getting better. She's stronger every day, and you can visibly see it in her. She's stronger. She's starting gradually to put weight on. Her positivity levels have soared, and the stats are getting better. Her spleen is reducing. The hemoglobin is increasing in her blood, so that the stats are looking positive. She's already defied the doctor's odds of 3 weeks, and that's because she refused to believe. She went on Google. She had a chat to other people. There were people there who had recovered from what she had, even in that terminal diagnosis. And she's determined to either get a bit more out of life, or even her ideal vision is recovery. So this is what I'm talking about in terms of that limiting belief that there is no cure for endometriosis. If you believe that, then you will not be cured. If you look at other people and say, actually, they've got over their endometriosis, they've got endometriosis, they're living life to the full, then you can do the same. Okay, so the second misnomer, mystique, myth that I'm going to come to, we don't know the cause of endometriosis. Now, this is similar again, and to some extent it doesn't really matter. You've kind of got it. Does it matter if they don't know the cause? Yes, because you've got a better chance of getting rid of it or minimising your symptoms if you know what that root cause is, and that's where Eastern medicine comes in. Western medicine can't give us a definitive answer, and we've had loads and loads and loads of myths or theories over the years in terms of Western medicine, from anything from it's an STD, I've heard that in the olden days, bleeding that kind of goes back into the womb from your menstrual cycle. These aren't true, but there have been theories over the years. So there's lots and lots of different theories. In Eastern medicine, Chinese medicine, Indian medicine, there is the belief that healthy bodies have energy, blood flowing through them without any blockages at all times. So disease and dis-ease in Eastern medicine comes from the idea of blockages in this flow. So in terms of Eastern medicine, and this is generalization, I go into a lot more detail in this in sort of specific workshops and things, but in Eastern medicine, we can look at endometriosis as a symptom, if you will, of blockages within our abdomen, blockages within our pelvis, which can come from a variety of different things. It could come from a physical accident, a physical trauma. It could come from a deep-seated emotional trauma. And that's not to say it's in the mind, I'm coming to that later. Or it could come from our ancestors. It could be an inherited issue that we've inherited. There is a cause of your endometriosis. So similar to the cure, endometriosis is a very personal illness. So if you can discover your cause, if you can discover your cure, that's all that matters. And again, this wide-ranging, there is no cause, there is no cure, we don't know the cause, that impacts on your belief and your mentality that actually you can overcome this illness, because it sends out this message that it's all a hopeless cause, that it's just a lost cause, that there's nothing that can be done to help. Western medicine doesn't understand it. So all of that, whilst there is a grain of truth in it, whilst I'm not saying that it's not true, it's a myth. It's a myth in terms of you. So as an individual, there will be a cause for your endometriosis. And as an individual, if you can find that cause, then there is a possibility that you can undo that cause and free yourself from your symptoms, even from your endometriosis, because it is possible, because other people do it. So the third myth, it's just a heavy period. Yeah, it's not. I mean, kind of it is, in that it's a very horrible, heavy period, but it really isn't just a heavy period. And anybody who has endometriosis will know this. The myth that endometriosis is simply heavy, prolonged bleeding around that part of your menstrual cycle, around your menstruation, again, is a myth. Some people find that they get worse pains, worse symptoms in the middle of the cycle, sort of around ovulation or even sort of in between the two. So it isn't just a heavy period. The bleeding sometimes is not even the worst symptoms that people, again, if you've got endometriosis, you will understand that the bleeding is just part of what it is. So again, try to tune out the people who are saying it's just a heavy period. And sometimes you can hear that from doctors as well. This is the thing that frustrates me most about the world of endometriosis. In the 20 years since I was diagnosed, attitudes really haven't changed that much, or some attitudes haven't really changed that much. You could go to the doctors a few times before you're actually heard. This is not just a heavy period. It's really, really essential to understand the symptoms of endometriosis and other related conditions as well, because it isn't just endometriosis. Thanks, Jen. Yeah, it's not just endometriosis. There's a whole range of pelvic illnesses that fall into this category. So try not to take on board anybody who says it's just a heavy period. Absolutely fight it if you want to fight it, or ignore it, but just don't take it on. Don't take somebody saying it's a heavy period as a fact. Just like I say, fight it if you want to fight it. If you haven't got the energy to fight it, ignore it and move on and find somebody who does actually understand. I'll be talking about symptoms, the common symptoms and the more hidden symptoms over the next couple of days as well. Over the lives on Friday and Saturday, we'll be looking at the symptoms as well. It's really important to understand the symptoms. It's really important to understand what a healthy cycle looks like and feels like, because as soon as any of those symptoms of endo sort of crop up, it's really important to understand that it isn't just a normal but heavy period, and these are the things that are going wrong. So the fourth one, the contraceptive pill cures endo. So again, same as 20 years ago, many doctors and health professionals now will just put people straight onto the contraceptive pill as a form of medicating endometriosis. The contraceptive pill does not help endometriosis. In some cases, it will stop your symptoms, because what it's doing is stopping the bleeding. So if the bleeding, if that part of the menstrual cycle is one of your issues, is one of your symptoms, is one of your triggers, then the contraceptive pill will help, because it stops that menstrual cycle. It basically takes control of your cycle. However, it's not actually sorting out your endometriosis. And a lot of my clients, myself included, have actually reported that when they come off the period, their endometriosis symptoms are even worse. And that's because endometriosis loves estrogen. So if you're, and it's the same with menopause, and this is where Jen comes in terms of my program. If you're feeding estrogen into your body, and other hormones as well, then you're actually potentially feeding that endometriosis. So whilst the symptoms aren't there because you're not bleeding, because you're not having that natural cycle, actually what's happening in the background is your endometriosis can be getting worse because it's being fed from the hormones that are being put into your body. And that's equally true with the implant as well. So again, I went down the implant route 20 years ago. That's not changed in 20 years. But yeah, it's the same principle. You're kind of banging all these hormones into your body whilst your endometriosis is almost dormant because you're not having that regular cycle. So like I say, a lot of people whose cycles are the triggers, are the symptoms, they will feel as if it's helping, but actually what it could be doing is making it worse. It's, again, absolutely informed choice is everything with any healthcare, but especially endometriosis. So don't believe the myth that the contraceptive pill or the implant will cure your endometriosis or will even help your endometriosis. There is a chance that it will make it worse because of the estrogen and the hormones that will be coursing through the body. Every healthy cycle needs a good balance of your hormones, and by disrupting that cycle, however good the intention, however beneficial it is in terms of stopping that cycle, stopping your symptoms for a bit, any disruption to that natural cycle and that natural balance of hormones will be doing something to your endometriosis. Okay, so myth number 5, older women get endo. I'm not certain how prevalent this myth is anymore. Certainly when I was going through, when I started going to doctors, because as we know, in the UK it takes, well, at the time I think it was about 8.5 years. That's reduced to 7.5 years. Aren't we lucky? Between initial contact with health specialists and actually getting the diagnosis. When I went to the doctors and GPs and specialists in those in my early days, I was kind of told that I couldn't have endometriosis because I was in my early 20s at that point. And they were kind of saying, well, endometriosis really only happens when you're kind of heading towards your latter reproductive years, scarily 30s and 40s. That's not true. That there kind of is statistical evidence behind that, but interestingly, that's because in the early days before laparoscopies, the way of diagnosing endometriosis was even more invasive. It was I can't remember the name of it. It was laparostomy, I think it was called, and it involved an even more invasive surgical procedure. And normally, I mean, endometriosis was kind of dismissed until after women had had children. So what was happening was the diagnoses of women was happening while they were in their late, well, sort of 30s, 40s, because they'd had the children, they'd had, because I should have said, because the operation had an increased chance of infertility. So they would not perform the operation on anyone who hadn't had children. So pretty much 100% of the diagnoses of endometriosis were happening to older women. And that's why the stats suggest that older women get endometriosis, because only older women were being diagnosed at the time that the stats were being collated. So again, there's no grain of truth in it, but there's a kind of a scientific stats-based evidence behind this, but the evidence is flawed because they weren't diagnosing younger women. It absolutely can have endometriosis in your teens, in your 20s, right up to menopause doesn't sort endometriosis. So you can have endometriosis at any time in your life. There's no thing about being too young or even too old for endometriosis. So the 6th myth that I'm going to look at today is the infertility myth, and this one drives me absolutely crazy. So many women think that they can't have children because they've got endometriosis, or that they will find it difficult to have endometriosis because there's children. Right, okay, I've got a stat bomb, and having just dissed stats in the last one, I've got a stat bomb for you. So the rate of infertility in women without endometriosis is between 10 and 20%. So 10 and 20% of women of childbearing age struggle with infertility or are infertile. Of women with endometriosis, the stats suggest that, sorry, I've got that wrong way around, 10 and 15% of women, I've given the game away now, 10 and 15% of women without endometriosis are infertile. Between 10 and 20% of women with endometriosis are infertile. So yes, the stats could be a little bit higher for women with endometriosis, but only 10 to 20% of women with endometriosis are infertile. Now, if you think there's 1.5 million people diagnosed with endometriosis in the UK, and 10% of them, or 20% of them, worst case scenario, are infertile, that's a heck of a lot of women that aren't infertile. And actually, I don't know anything else, again, that you would say when you see these adverts on TV and they're kind of giving the stats at the bottom. If somebody said to you, this is a fantastic product, this is guaranteed to help you, 20% of people agree, you'd think, no, that's rubbish, I'm not going to buy that, only 20%. Yet this fertility myth that we buy into, yes, some people might find it more hard to get pregnant with endometriosis, but actually there are different diseases in the pelvic area that aren't endometriosis that make it even harder to get pregnant. So this myth around fertility and endometriosis is really, really scary, because I go back to what I was saying in myth number 1 about limiting beliefs. Your body will believe what your mind tells it. And I'm guilty of this. I spent a long time, I was told when I was diagnosed in sort of 23, 24, as I was going through all of the diagnosis, I was told that if I didn't have children there and then, I would probably struggle to get pregnant. Well, I couldn't have children if I didn't have children then. And I believed that, and I didn't want children then, so I didn't have children then. I wasn't going to be, I'm quite stubborn, I wasn't going to be forced into making such a massive decision. So I believed them. And at the start of every relationship I had through my late 20s and 30s, my bog standard thing was, you need to know from the offset, I can't have children. I believed that I couldn't have children. And sharing my personal story, I'm 43 now, soon to be 44. Late to the party, as always. I've decided that actually I wouldn't mind a little kiddie. So last year, pre-COVID, cracking timing, we started on an IVF journey. And my stats are the stats of somebody who is struggling with fertility, but who is in their early 30s. And I'm actually getting quite emotional, because it really winds me up that for 20 years, I believed I couldn't have children. So I kind of thought, I'm just not going to go down that route. And it's so sad that so many women that I see, so many young women that I see online, who I talk to in my calls and who are my clients, have that belief that they can't have children because they have endometriosis. Now, I don't know about you, if you're in that situation. They told me that I couldn't have children without even checking my fertility. Nobody ever did a fertility check on me to tell me that I couldn't have children. It was literally the endometriosis diagnosis. I had stage 2 endometriosis on my ovary. And that was enough to tell them that was enough for them to tell me that I couldn't have children. So please, if you don't take anything else from this whole month of endometriosis, get fertility checked. If you have endometriosis, if you believe that you can't have children, still go for fertility checks if you're able to, because you may well be surprised. And like I say, this links back to the first myth of that self-limiting belief. If you tell yourself you can't have children, then you're kind of perpetuating that myth. Your body is listening to you, your mind is listening to you. If you say you can, or if you say you can't, you're right. So just make sure, again, it's personal to you, just make sure that you have tests that actually test your fertility, and it's not just done on the basis of your endometriosis diagnosis. I suspect a lot of you are a lot more savvy than me, and you do that anyway. I never even thought to double check, because I didn't even think it was something that needed to be double checked, because the literature says that we struggle to have children too. Okay, so that's myth 6. Myth 7. Childbirth cures endo, or pregnancy cures endo. This is another thing that you quite often, not as often as it used to be bandied about, but it still is bandied about. You hear people say, oh, just get pregnant, that'll cure endo. Again, it has done for some women. I do know some women for whom their endometriosis has cleared up after they've had children. And again, I mean, bizarrely, if the myth that you can't have children with endometriosis is true, then why on earth would we have number 7 myth that childbirth cures endometriosis? Because if we couldn't get pregnant, we wouldn't need... Anyway, I know I'm preaching to the converted, but it drives me mad. So yes, childbirth cures endo. It doesn't. For some women, it has cleared it up, and that will be because of their individual cause. So they might have an issue with their pelvis that's been causing their endometriosis, that the pregnancy or the childbirth has naturally put right. So for example, if the cause of your endometriosis is a tilted pelvis, if the root cause of your endometriosis is a tilted pelvis, and you have a difficult childbirth. Now, in a woman who hasn't got a tilted pelvis to start with, a difficult childbirth might actually result in a tilted pelvis, which is why a lot of women see endometriosis happening after. Well, it's not the reason, but it's one of the reasons that a lot of women find that their endometriosis either starts or flares up after childbirth. But yeah, in a woman without endometriosis, a difficult birth might result in a tilted pelvis. However, what can happen, what I've seen happen, is a woman with a tilted pelvis with endometriosis, the childbirth actually sorts out the pelvis. And so that is no longer an issue. So therefore, their endometriosis clears up. Let me also just say about the hormones as well. So again, there's an issue around hormones. So it could clear it up. Your cycle changes a little bit after, well, certainly during pregnancy, but like after pregnancy as well. So there could be issues around there that sees women's endometriosis feel a bit better after childbirth. But certainly the myth or the sentence that childbirth cures endometriosis is another myth, and it sadly isn't true. It may be true for you, but don't bank on it as a cure. The same as the contraceptive pill and the implant. If it does cure it for you, then that's valid, but it certainly isn't something that we can say with any certainty. So the next three I've kind of lumped together as really, really damaging myths. So I've got number 8, sex causes endometriosis. The 9th one, tampons cause endometriosis. And the 10th one, abortion causes endometriosis. None of those 3 are correct, and they are all disgusting examples of myths around endometriosis as well. Not only does this put the blame on the person who has endometriosis, but there's kind of a bit of stigma and value judgments attached to all of them as well. So no matter if you do all of those 3, the only thing I would say about tampons do absolutely not cause endometriosis. However, one of the things I do look at with my clients is toxins in your environment and toxins that you're sort of putting into and onto your body. Now, I always say to my clients, if they're happy to stop using tampons purely from that point of view, purely from the toxins point of view, and switch to a more natural method. So, for example, a moon cup or unbleached products. But that's because of the toxins. That is certainly not causing their endometriosis. And the same with abortion, the same with sex. That does not cause endometriosis. And anybody who even hints that they do, again, I think these used to be more prevalent in years gone by, but I do still read them, I do still see them, I do still hear them being bandied around now. Endometriosis is an illness, and its cause is not sex. It is not an STD. I know, again, you know that, but that's something that I feel very, very passionate about. And again, challenge that. If you feel you have the energy to challenge that, whenever you hear it, challenge it. If you don't feel you have the energy to challenge it, don't absorb it. Just walk away, and do not dwell on it even for a second. And then the last myth that I want to look at today, the myth that it's all in your head. And again, it's so sad even that we have to say that in today's world. Endometriosis is real. It's a debilitating illness. It really does impact on people's lives. And it isn't just a fallacy in somebody's head. However, there are 2 howevers to what I'm about to say. One is relatively recognised, the other one is slightly controversial. That's recognised in my world, but Western medicine, I feel, just has to catch up a little bit with this one. So the first one is the one that's less controversial. So there is an emotional element to endometriosis. Endometriosis can cause things like anxiety and depression. Really because of the impact that living with chronic conditions has, and not just the pain. Pain is a massive, massive issue for a lot of people. Again, not just endo, but pain is a massive, massive thing to live with. And if you're living with pain on a daily basis, then that can cause anxiety, that can cause depression, it can cause low moods, fear, frustration, anger, all of those negative emotions, because just with the stress of living with pain. And again, I'll go into this later in the month in terms of that depth of emotion and how it can be linked to endometriosis, how endometriosis can cause these negative emotions and how to deal with them. So we will be looking at that. So there is an element of that emotional component to endometriosis. That is not by any stretch of the imagination saying that it's all in somebody's head. Endometriosis isn't all in your head. However, aspects of it may be being made worse by the pain and the impact on your emotions of the pain and the bloating and the endotomy and all the other crap that we have to deal with. That does impact emotionally, which can in turn make symptoms worse. And that leads me on to the more controversial thing that I'm going to say in terms of it's all in your head. Now, I alluded to in myth 2 about the cause of endometriosis. And again, I'm not saying that this is a definitive cause. However, one of the things that I have seen in a lot of my clients is the impact of an emotional trauma or traumatic event or ancestral trauma on their endometriosis. And again, I go into this in a lot more detail. I have specific workshops on this. Again, with my one-to-one clients, we look at this in a great load of detail. But just sort of as a bit of an overview today, in my world, emotions are very, very strongly linked to muscles and also very strongly linked to organs. So Chinese medicine links every emotion to an organ and a meridian, but specifically organs of the body. And also in Eastern medicine, we look at that actual link between emotions and specific muscles. Now, we have so many really, really important muscles running through our abdomen, running through our pelvis. Some really big muscles, some muscles that are so important in our day-to-day lives, even in breathing. A lot of these muscles kind of govern how well we breathe. Breathing is essential in terms of pain management. So if those muscles in our pelvis aren't working, that impacts on so many different things. The biggest muscle we have, and this is one that I will talk about in more detail later in the month, is the psoas muscle. And that psoas muscle is so important. So many people I see with endometriosis have really tight pelvic muscles. When we talk, I mean, I have a fantastic colleague on my Halcyon Days programme, Beth, who is going to do a talk in here later this month, she's a pelvic expert. She looks at prolapses. But one of the things that, if you go and see a pelvic expert who isn't like Beth, who just does generic pelvic stuff, then a lot of the stuff you get with pelvic yoga and things like that are all around loosening off the pelvis. Sorry, other way around. It's all to do with tightening the pelvis because the pelvic muscles are too loose. However, it's been my experience over the years that a lot of clients of mine with endometriosis, their pelvic muscles are too tight. So the last thing they want to be doing is tightening those pelvic muscles. It's all around relaxing the pelvic muscles. The psoas is one of the biggest muscles you need to relax if you've got endometriosis. Chances are it could be way too tight for you at the moment. So loosening off that psoas is absolutely crucial. Now, I don't want to go into too much detail because, again, I could talk for half an hour on this alone. But the psoas muscle is linked to feelings of vulnerability. There's a little bit of fear in there as well, but it's all around being vulnerable. It's all around either a fear of being vulnerable or prolonged times where you felt vulnerable. So if you've had a childhood or a big traumatic experience that's left you with feelings of vulnerability, that's all stored in the psoas. So in order to release the psoas properly, and again, we'll go through I've got some really, really easy psoas release techniques, which we'll go through later in the month, which does the physical release. You also need to look at the emotional release as well. So endometriosis is not in your head. However, there could well be an element of an emotional component that's the reason behind your endometriosis. And that is quite controversial because a lot of people see that as me saying it's in your head, and it isn't in your head. What's happening in my world, what's happening is a prolonged or a significant emotional reaction is causing a physical reaction. And that physical reaction over time, again, is causing the endometriosis. So endometriosis is not in your head. That is a myth. However, it can cause emotional, psychological issues, and there's a possibility that a component of your endometriosis, so a cause of your endometriosis, one of them could well be past trauma. And by past trauma, I also mean the ancestral trauma as well in terms of the link. We're going to be looking at that ancestral link later on in the month. We're going to be looking at the reasons behind why possibly endometriosis is more prevalent in the family, and looking at epigenetics, which again is something I look at with my one-to-one clients, and looking at healing that ancestral path to overcome endometriosis if it is in your family. So I hope you found that enlightening. If you've got any questions about anything that I've said, I know that a couple of you have been dropping on and dropping off through the session. It is quite a lot to take in on a Thursday lunchtime. If you have any questions, feel free to put them in the comments because I'll be picking them up whenever you post them. If you're watching on replay, give me a hashtag replay and tell me what your biggest learning or what your light bulb moments, if you've had any, or like I say, your questions, or feel free to message me directly. Thank you very much for watching, guys. Enjoy the rest of your Thursday, and I shall see you tomorrow where we start to look at the symptoms, the common and the hidden symptoms of endo. Thanks, guys.